Big ideas in small bites. This is Bite Sized, brought to you by Accenture.
Welcome to Bite Sized. I'm your host, Bella Thornley, and today I'm honoured to welcome Professor Mihaela Vanderschaar, a leading voice at the intersection of AI, medicine, and real-world impact. She is the John Humphrey Plummer Professor of Machine Learning at the University of Cambridge, and she leads the Vanderschaar Lab, a world-class research group pushing the frontier of what AI can do in healthcare and beyond. Mihaela, I'm thrilled to have you here to unpick your vision of AI genies and to explore what they might mean for organisations, industries, and society at large. However, before we get into AI genies, I would love to hear your definition and point of view and the work that you've been doing with LLMs versus AI agents at the very beginning.
Thank you so much. So first, large language models, or for short LLMs, are predicting text based on different type of input prompts. At the same time, AI agents, or agents for short, or LLM-based agents, because often these agents are based on large language models, are systems that are able to act, and they are augmenting large language models with context management, memory, documents at times, the ability to make decisions, so to plan and to take actions. And these actions could involve tool usage, but could involve environment interactions or APIs. And what was exciting 2.5 years ago when we started to build these agents for code generation was the realization that in order to build large code bases, we need also the ability to deal with large context window sizes, as well as the ability to debug complex code. So debugging was important, dealing with large context window sizes was important, and that's well known to be a problem for large language models. And what's also exciting is that we didn't just build code. Then we started to build all sorts of interesting logical programs, including cookbooks. Other types of agents that we built were agents for doing discovery, especially in the biological area. For instance, agents that discover laws. These laws could be in physics, but could be also in pharmacology. So we discovered, for instance, a new pharmacological model for warfarin, which is a drug that's well known for many years. Another type of agent that we have built is doing what we call autoformalism, is interacting with experts, very much like you in Accenture are doing, from different areas: medicine, finance, communication networks. And it's taking the problems of these experts and translating them into formalisms automatically that could be solved using optimization methods, using reinforcement learning methods. So it's doing, if you like, it's becoming almost like a consultant assistant. Finally, another agent that I'm excited to talk about is an agent that is helping us disambiguate requirements. This agent is able to really help put the right questions and uncover and unravel the right requirements, the right parameters, the right setting in which this problem needs to be solved. And this is done again with the help of an agent.
Amazing. So how did you get from Italian cookbooks to some of those other examples, discovering laws? Where was the evolution from that?
So we are a lab that we call reality-centric. And my lab is very fortunate to be funded and collaborate with a large number of companies, some of them in pharma, but also some in tech, such as Microsoft and Apple, some of them in consulting, and some maybe just charities. So very diverse set of let's say, sponsors. And these different sponsors have different needs. And it is on the basis of these different needs that the ideas came for these agents. And again, I emphasize that because often we think about code, and initially we did think about code, and of course Copilot for Code is very useful, but many things can be represented in what I call symbolic programs that have logic, that have the ability to compose something in routines and subroutines. And this is why I want to say code, but also something like a cookbook where you have ingredients, you have requirements for, for that particular recipe. And there is, if you like, a flow of the recipe associated with it, which needs to be, how shall I say, logically correct and hopefully taste well.
Yeah, the Italians will be very upset
Yes, yes.
if it doesn't taste good. So you mentioned your lab was one of the first to actually sort of build agents, but in your manifesto, you've taken that one step further and described a sort of new paradigm of genies. Could you explain what you mean by genies and again how these differ to the agents that we've just discussed?
Thank you. I started to think about these next generation agents, which I call genies. And what are they? They are sophisticated, multi-capable AI companions to humans that generate ideas, plans, but also have strategic thinking. They are able to reason adaptively, continuously learn, and have as priority human empowerment. So really they are designed to amplify human potential rather than replace us humans. And this is by design. So the empowerment happens through collaboration, trust, but also transparent decisions and dialogue. They have the ability to communicate with other agents, with other genies, but also communicate powerfully with humans. And there may be different languages of communication with other genies as opposed to humans, because it's almost like different languages. So we want to move in this way beyond the narrow task of just solving a particular pre-specified task, which is what agents currently do, and allow these next generation agents to be creative, to innovate. A very big part of the genies will be this ability to create and innovate outside the realm of things that they have seen so far, but also execute much more complex and multifaceted plans. So not only just, let's say, optimize the problem at hand, but take a complex problem, I don't know, optimize the logistics in a particular hospital or a particular clinic, or think about traffic and traffic improvement in a particular city. So that is not just one step, it's multi-step. Multiple steps will need to be evolved one after another, and there needs to be what I call a strategic plan. So this goes beyond current ideas in reinforcement learning into the future, if you like. Then actions are important because these agents may work with other agents and humans in symbiosis to form these different, and execute these different plans, and they may need to adjust in real time their actions. They also need to learn continuously such that they can adapt and upskill themselves. And last but not least, very important to me, they need to empower the humans with whom they are collaborating.
Are you building different types of genies based on how, what humans they're supporting or how they're supporting them?
Very much so. So I feel these genies may have different types of personas and different types of specialties. And actually in these genies, let's say blog, manifesto if you like, I collaborated with a few researchers to come up, for instance, with a genie that specialized in assisting clinicians. Mm-hmm. One that's very much a bioscientist of the future, and one which is helping and thinking with managers and CEOs of small to medium-sized companies. I also want to say that we don't have these genies today. We have agents today. Mm-hmm. In this work, in this genies blog, I have 101 questions, and there were many more. So this manifesto has two different audiences. The primary audience is the machine learning AI community. Many of people in Accenture that are building agents, it is for them and for others in the machine learning community to provoke them to build these capabilities, not just do what currently agents do, which is, I think, too limited, but rather build these new capabilities. And building some of these capabilities through these 101 questions and more may require a lot of thought. So I collaborated with both young and old clinicians to build the genie for a clinician. And I was quite excited to hear very different visions these different clinicians have, depending on their specialty, how old they are, how adverse they are to technology. And don't think that the older clinicians are necessarily the most fearful ones. At times, it's the mid-career ones that are more afraid. The ones that are towards the end of their careers are very much wanting to kind of reshape it and rethinking with technology because they want to see this future really finally happening.
What is your view on how do we ensure that we get the most value out of AI and out of these genies, but where is that line before it starts taking over jobs?
This is a very complex question,
Yes.
and one that I'm very mixed about. This is why it's very important in the type of research I build that human empowerment, transparency, dialogue with humans is central. I impose that in all the research that we are doing. But what will this future look like requires all of us to be involved in this conversation. I think the worst thing we can do is be afraid and say, I don't want to learn about the technology, I don't want to think about the technology, or the other way around to say, this is a dream, it will never happen. I think it will happen, and it will be very important for us to design that future and co-design that future. So I want to invite people to think about how they want to collaborate with these agents or genies. How will this future look like for their particular area of expertise? I've had a little session. I was invited recently to give a keynote talk at the AI Science Day at AstraZeneca, and I presented kind of this platform and this idea, and it was tremendous, the ideas that came from the audience, including having new ways, new communications manager roles for this setting, because maybe we need to think about communication in different ways and communication between humans and machines in different ways. And
yeah, I think that's very interesting of nearly to think of just new roles of the future is rather than going, oh, my role will not exist. It's just I'm going to have a different role.
which maybe you can envision.
Yeah.
Which is, I think, scary, but also quite exciting, because let's be honest, we get bored. Part of the reason I was an engineer, then I turned into an economist and a machine learner is I got bored after some time.
I mean, I won't need to make any more PowerPoint.
Definitely not.
No more PowerPoint for a consultant. What's your view on the minimum amount of, you talked about where should the human be in the loop. What is your view? Is there a minimum in a process that there should always be a human?
I think so. I think we should demand from the machine learners like me that this AI is truly transparent, that the humans can understand the different steps, can understand the innovations that have happened, and is not just a big black foundational model that spits out some type of, let's say, prediction or action recommendation. But rather, foundational models have their role, but they should be invoked as tools, and we should have really transparent predictions, transparent decision-making process, transparent reasoning, and very clear communication between AI and humans. And I think we should mandate that, because we want to be in charge, we want to be able to verify, we want to be able to be smart and understand. So I am quite in the camp that I feel for most areas of humanity where we care about AI making a difference, finance, smarter cities, medicine, science, we want to understand.
There's a few naysayers out there. What is the one thing that you would say to them about whether there is this real potential that people believe in AI?
Well, I would say that really we are on a cusp of really quite a transformative technology. And almost, I would say, almost every job you are in may be transformed by AI. I do think that this will happen. And what I think is exciting is not to think about AI doing the same job as you are doing today, but rather an opportunity that each one of us has, in whatever role we are at, to really collaborate with AI, to envision a new, let's say, creative job of the future. So I think that if you look at the past century, all of us were in jobs that were quite repetitive and potentially quite boring. Now we have an opportunity to use this technology to create new blends of a particular profession and evolve this profession in a creative way. So I still think we are going to have expertise, we are going to have know-how, we are going to have likes and dislikes, but we could collaborate with the AI, whether it's agents, whether it's this next generation of agents that I call genies, to really invent and create new jobs and new, let's say, solutions to problems we need to solve. And I'd kind of encourage everyone to really get engaged with this technology, to think about this technology, not expect the AI people to develop the technology that's right for them. If you let the geeks like me do that, we will come up with solutions that are bad, that are boring, and maybe even scary. What I would like to provoke everyone is to think about their jobs, whether they're almost all of us as humans have creative jobs in one way or another. Otherwise, we would not be doing them. And that's an opportunity to really create version of these jobs that where we can collaborate with the AI to make some tasks easier, and at the same time to bring new dimensions, new perspective, to do things in more innovative ways, in better ways, in more efficient ways.
So whether you believe in the full potential or not, it's important to be engaged in the solution and the designs of the future. You do quite a lot of work in medicine. It's going to be really important around that transparency. But what's some of the exciting opportunities that you've seen about applying AI, going back to your point of real impact, real world impact in medicine?
So often when I talk to clinicians, they say the biggest impact on worldwide health will not be solving cancer or solving cardiovascular disease, even though these are two diseases to which I work, but rather or improving the efficiency of the healthcare system. How can we use AI to improve the efficiency of the healthcare system? I do a lot of work in this area, and I think a lot of work can be done. So if you are working in, let's say, better flows of admissions to hospitals, identifying which patients are at risk in the hospital, better triaging, better scheduling of patients, but also many other things. Early and timely diagnosis. We know that many diseases, cancer in particular, if you identify at the right time, the chance of survival and also the cost associated with this to the patient and to the healthcare system will be much lower. So I'm very excited about that. A lot of work that happens in our work in our lab in that area. Another one, I used to be working a lot on risk prediction, trajectories of disease, at different stages of disease, interventions and treatments, causal inference. But now a lot of this I'm putting together under the umbrella of something I call digital twins, where we are trying really to build digital twins of patients. And these digital twins could be given to the patient themselves, but they could also be monitored by the different healthcare providers that may interact with this individual. And they could be based on a lot of data. They could be clinical data, but it could also be wearables in the future. And I'm quite excited also about the role that I can play both at home in empowering the patients. I've not done that much work in that area, but I'm increasingly doing so. Most of the work that has happened in the lab in these digital twins has been in clinics and hospitals, where we look at a variety of diseases, different types of cancer, cardiovascular disease, cystic fibrosis, Alzheimer's. In particular, these are 4 diseases that we do quite a lot of work with clinical collaborators to really try to understand progression of disease, when to intervene, how often should a patient with such a disease come back, who should be recruited in a trial, for instance, and so on.
Could you just quickly define for everyone what we mean by a digital twin?
By a digital twin, we mean really a generative model that is able to simulate on the basis of the available data of an individual, but it doesn't need to be an individual patient. It could be an organ, it could be even a healthcare system. So we talk about digital twins of individuals, but can be organs, can be healthcare system, can be even cities. So it's a generative model that is able to generate most probable future scenarios. We generate what are likely future of this particular entity or individual, possibly under interventions. So we take, for instance, Mihaela, and a digital twin of Mihaela will have what will happen to her in the short term, in the long term, what will happen if she eats better, exercises more, does take in preventive measures. And if, God forbid, she gets a particular disease, how can we intervene to help her live longer, a better life, and so on?
So in 5 years' time, what headline would you like to see? And what part or role would you like to have played in creating that headline?
This is even tougher a question. So, well, I hope that we have built some genie network that was able to discover something new and powerful in cancer, both mechanistic models and pathways, but also better ways of understanding how drugs work. And I hope that this is a result of both humans and genies collaborating. So I would love to see some discoveries being made in cancer. I'd love also that we are capable to build this platform of discovery with these genies collaborating with humans, and we have it in such a resilient way that scientists from social science, from finance, from other domains can come to this platform, play with it, and find new discoveries in their world. So I also hope that by the time, in 5 years' time, we figured out the answer to your question. How can we live with this increasingly more powerful AI in a way that's empowering for us humans, that's creative, that makes us smarter, more capable? And on that note, we work quite a lot also on AI for education. I'm also excited about that. I hope that we are going to build more and more genies that are going to become friends with children who may not like math, but are starting to love math, not due to a teacher, but maybe due to such a genie.
Amazing. I will leave it to the experts to try and create that headline in the newspaper, but probably going to read something around humans reach their genie level potential. Mihaela, thank you very much for joining me today and for explaining so clearly the future of AI agents while grounding us in real-world examples. This was Bite Sized, and I hope you enjoyed listening.